6:19 right now, and May is American Stroke Month. Your first line of defense against stroke is really to eat healthy, diet, exercise, don't smoke. All these things sound familiar? Well, there are now some new studies that show there are some added and pretty simple things you can do to reduce your risk.
With us now is Dr. Ted Lowenkopf, one of the medical directors of the Providence Stroke Center. Dr. Lowenkopf, this is kind of exciting for those who don't want to get one of those strokes, because you don't know where that's going to take you. Dead or alive, are you going to survive? Why don't we just avoid it in the first place? Tell us about some of the new evidence that you've found that can help us avoid strokes.
Good morning. Yeah, there is evidence that vitamin D, either in supplement form and especially for people with high blood pressure who have vitamin D deficiency, it reduces your high blood pressure, can give you a normal blood pressure, and can reduce your risk of having a stroke.
All right, so we can't tell Mother Nature to be sunny more often, although we'd like that. So how else can we get vitamin D?
Vitamin D, well, as we said, sun in your intro about how nice is it outside going out for a little while, and too much sun is actually bad for your skin. Other ways of getting it is from foods like dairy, fatty fish like salmon and tuna, egg yolks, fortified juices like orange juice with vitamin D, fortified cereals.
There's another new study that shows eating high-fiber foods may lower our risk of stroke. What can you tell us about that?
Yeah, again, what they do is they study large populations, look at the intake of things like vitamin D, or as you say, water-soluble fiber in things like beans and nuts. And they find that the people who have these diets have a reduced stroke risk. And in the study that you're talking about, it's about 7% stroke risk by having 7 grams of dietary fiber.
All right, so we talked about high blood pressure being a big risk, the biggest risk really in a stroke, risk factor in a stroke. So what is too high for blood pressure?
So I always say know your numbers. It is the number one risk factor for stroke and heart disease, so you get a 2-for-1 deal there by having a normal blood pressure. 120 over 80 or higher is considered pre-hypertension, and high blood pressure is 140 over 90 or higher.
All right, and just before you go, just to remind people, what are the signs of a stroke?
So we have a way, most people have a stroke can't call 911, and that's the final part of what you need to do if you recognize a stroke. So if you look at somebody and you look at their face and you ask them to smile and one side doesn't come up or droops, that's the face, F in fast. The A in fast is arms. Ask a person to raise both arms. If one arm drifts downward or doesn't move, they might be having a stroke. S is speech. If you ask them to repeat a sentence, do they make mistakes? Are they slurring their words? And finally, T is time. If they have any of these signs, call 911. Stroke is an emergency. Urgent treatment can reduce the risk of dying or disability from stroke, and we say time is brain.
Okay, Dr. Lowenkopf, thank you.
Thank you for having me, and thank you for raising awareness around stroke in Stroke Month.
Oh, you bet. It's really important. Dr. Ted Lowenkopf was one of the medical directors at Providence Stroke Center.